Thanks for being here with us for our special report, The Next Normal State of Our Schools. I'm Jessica Cunnington. We are continuing our conversation tonight about our next normal post-pandemic and what our schools will look like in the immediate future and beyond. And we are so happy you are joining us for this conversation tonight, and we want you to call in to ask your education-related questions by dialing 718-861-6800. But as you can see, we have a lot of people joining us for this conversation tonight for the town hall. And joining us is pediatrician and the director of clinical services at the Monteviere School Health Program, Delaney Gracie, Kevin Dayhale-Fuchel, the executive director of counseling in schools. We have two of our News 12 education ambassadors and parents too, Farah Despain, who is the president of District 8's Community Education Council, and Angela Torres, a Bronx parent advocate. And we also have with us tonight Dr. Joanna Johnson, the Chief Achievement Officer at the Eagle Academy Foundation. We also have John Riley, the Northwest and South Bronx Regional Superintendent of the New York Archdiocese. Thank you so much, all of you, for being with here. So as you can see, a variety of perspectives on the state of our schools here. For those of you at home, totally feel free to call in and ask any of these panelists your questions that you have tonight. But first, let's talk about the recent changes announced here in New York City when it comes to schools. Just announced today by the mayor, full day 3K is expanding in the fall in the remaining 16 community school districts, adding up to 16,500 seats. Also, high schools reopened for in-person learning on Monday. The city says about 20% of high school students are back for hybrid and in-person learning. The rest are still remote at this point. And by the way, PSAL sports start conditioning on April 5th coming up. And starting today, the new opt-in period begins for any parent who wants their child to come back into school who's not right now can put in for that during the next 2 weeks. Elementary school students will be prioritized for that here, and this has really gotten a lot of parents talking and heated as well. Literally hundreds of comments on our social media pages about this new opt-in period. So let's get right to Amanda Bossard, who is tracking all of that and some questions tonight. Amanda?
Yeah, Jess, certainly a lot of opinions on this first day of this new opt-in period for city students. Like you mentioned, we're hearing from so many of you about whether or not you plan to send your kids back to their physical classrooms. And over on Facebook a little bit earlier this morning, we asked you, will you be sending your children back to school for blended learning? That post, like Jess mentioned, is getting hundreds of comments, and we want to dive in and take a closer look at a few of them coming in. Heidi saying she's not ready yet. My son's school closes every other week, or it has 2 to 3 confirmed positive COVID-19 cases, and then it has to shut down for those 10 days. She has a household with 3 people who have serious health issues, and she just can't put her family at risk at this point. Looking forward to the fall there. Jessica saying, I will be sending my child back to school full-time. And then Karen says, my kids are doing excellent with remote learning right now. Their grades are the best they have ever been, perhaps due to less distractions within school learning. I think schools should keep some form of blended learning in their curriculum. Might even help with the overcrowding issue in some New York City schools, according to Karen. We also asked you over on Twitter. We have this poll that's live right now, so you can still chime in and have your voices heard here. We're going to be checking back throughout the evening to see what people are saying. What do you think the next school year should look like here in New York City? And right now, 61% say in person. So a lot of people already looking forward to September and what that next normal will be. But I want to get back to that opt-in period, and I want to get to our education ambassadors tonight, Farah and Angela. I want to ask you if this new opt-in period has prompted any conversations in your household. Is this something that you're considering? Farah, let's start with you, and Angela, if you could chime in when she's done.
Hi, good evening. Thank you for having me. So for your question, is it actually, no, in our household, we're not having any conversations about the opting in option that we just have, because it is understood that we're going to stay remote. And for September, I don't foresee moving away from remote.
And for myself,
Angela, would you mind
I'm also glad
offering
that I'm
your
here.
opinion?
And we actually are not considering doing the opt-in period either, but I want to mention that this is a great opportunity. I'm really glad that this option is being opened, because there are some parents that do want to do that. But the one thing that we have to contend with is the fact that schools keep on closing because of multiple cases. And so there's an emotional piece that is happening in the midst of this. And so I have to choose for my household consistency, because for my daughter, that's going to be the thing that's going to help her the most. And so I choose consistency, knowing that she has the same teachers every day, knowing that she has the same system every day, rather than having her go in for 1 or 2 days and then having it be closed for 2 weeks, and then being in for a week and then closed for 2 weeks. And that's exactly what happened in her school just over the past month and a half. I'm describing the exact thing, and they're closed again right now. So I think that that's the reason why we're choosing that.
And that's interesting. I mean, a great point that obviously we saw in a ton of our comments, that Amanda even read one of them right there, the consistency factor, and you'd rather having that. But it really is such a personal decision. And I do want to bring in Dr. Gracie too, to just get the medical perspective too, for all the parents that are sitting at home watching tonight, really kind of on the fence about whether they do want to opt in their kids for hybrid or in-person learning. What's kind of your advice to those parents, Doctor?
Sure, and thanks for having us as well. First, I absolutely want to give props to all the parents, teachers, students, principals who made remote learning possible so quickly last spring. I mean, that was an incredible community change that it's amazing how people stepped up and made that work for their kids and for their families and for their schools. And I think that's going to be with us in some form for a long time, for reasons, as you say, with school closings, or as you say, it's a very personal choice, and everybody needs to weigh what's going on in their family. Are there people that are higher risk to get sick? You know, are you able to work from home comfortably? There's a lot of reasons. There is new research that shows that the prevalence rates in schools, having kids back in school, really doesn't drive prevalence rates up in communities. So that's good news, and that's one of the supporting reasons for us, you know, opening more schools now. And there's also a lot of research and evidence that for many kids, in person is better. So a lot of kids do learn better in person and learn better with the teacher there. It's to identify problems or intervene more quickly. But as you say, some can do very well at home, and that can be very effective. But there's definitely social, emotional, developmental things that are really important for kids to be around peers and other people their age. And being in the structure of school and around other people can really help with that development. For many families, it helps with food insecurity. Some people really do still struggle with the technology or connectivity elements of remote learning. So it would be great to have in-person learning as a better option for people there. And for many families, the remote learning can be really disruptive to family dynamics. So either parents not being able to work at all because they're staying with the kids, or it being very difficult to do their job at home while the kids are simultaneously trying to do school. So for a lot of families, the in-person option hopefully will really help those family dynamics and help them with the things they need to focus on as well for themselves.
Yeah, just so much to take into consideration. And thank you for laying all of that out as well, especially when it comes to cases and what the data has shown so far. Really good for parents to hear that and just really hear across the board. You just have to make the best decision, you know, and the parents said it right there, for your household, your family, and for your kids moving forward. Just wanted to remind our viewers, obviously, you can call in and ask your questions, or really just bring up the concerns that you've been wondering and thinking about as we think about the next normal in terms of our schools and the state of our schools moving forward. We also have that QR code on the bottom of your screen that you can literally just pull up the camera on your phone, hover it across that QR code, and it's going to bring you to all the latest coronavirus and pandemic related coverage that we've been covering here on News 12, which of course has been extensive for literally the past year. So just a heads up, at any point during the next hour, you can put your phone right over the camera over that QR code, and it'll bring you there to the latest coverage. But we obviously have everyone from teachers to someone from the Catholic schools here representing, of course, our parochial schools as well. Also, Chief Achievement Officer at the Eagle Academy, Dr. Johnson. We also have, of course, a doctor who just spoke. So really such a variety of different topics that we can cover throughout the night. We're also going to be getting to your social media questions. So 718-861-6800 is the number to call. I wanted to quickly speak with John Riley here, representing our Catholic schools, just bringing you quickly in to talk about for the next minute or so about the new parent resource website that you guys put up not too long ago and how that's going to change communication moving forward.
Absolutely. Thank you so much for having me. Yeah, that's really one of the important points that we're very proud of. In the Bronx, what we've done is we created a parent access portal that allows parents to really go on and see what's going on within our particular region, understand the resources that we make available to them in terms of their own mental health of their children, which is paramount to us, particularly geared toward our mission to serve the whole child. That's the mission of the Archdiocese of New York, but also really to give them updates on the academic initiatives that we've been undertaking since the time in which the pandemic began. And I think that it's really allowed us to help our parents become community member supports and partners in everything that we're doing. And that's really the hallmark of Catholic education, is create that holistic, organic, family-oriented sense of moving forward toward a positive orientation for the future, regardless of the pandemic. And I think that it's really created a confidence in everything that we've done. We've become closer as a system. We've become closer as a community, and the parents appreciate the constant updates, whether it be on exams or faith-based issues, issues that are plaguing students that they may be experiencing as a result of the pandemic. Yeah. And I think that the fact that we have it in both languages, in English and Spanish, and we're receptive to any parent feedback as well as to any parent commentaries or suggestions, really speaks to the reason our schools have been open from the beginning. It's
John,
really
going to pause you right there.
Horns,
heading into a commercial break here.
Our doors are open and our hearts are open, and we're going to continue to keep our kids safe and make certain that we communicate to those parents so that they know.
We're going to be right. Welcome back to The Next Normal, and thank you again for our panelists for joining us for tonight's town hall discussion. We have some of you on the line, though, so I do want to get to Tiffany, another caller from the Bronx. Tiffany, what's your question?
Hi. So the question I wanted to ask was, currently the plans they have in place for students that are attending school and doing hybrid, the plan that they have for students with IEP, is that effective? Is that the best that they can do, or do they have plans on improving that?
Great question.
So I will start off by saying we have to make sure that we hold them accountable to make sure that that does happen. I think that parents are the greatest advocates for their children. And in this time, although many of us are excited for the opt-in period, our hope is that children with IEPs will not be forgotten. We have to make sure that we understand the IEPs, that we understand the language behind it, et cetera, and that all of the services, not some of the services, but all of the services are being given to that child. And if they're not given, you have to work with the school-based support team and everyone who's in place in order to make sure that does happen. So I definitely encourage you to advocate, 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 and ask those questions, even the tough ones. And if you're not satisfied, keep on asking.
Such good advice, Angela. Farah, did you want to add?
No, I will say that I agree with Angela, and advocate, 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 but also don't be afraid to make noise in terms of writing directly to the chancellor, writing directly to the mayor, connecting with other parents who have the same issue, so that you can build coalitions and so that you can have your issues addressed. Because the reality is this, children with special needs and who have IEPs, they have been suffering under the system way before the pandemic. And the pandemic, unfortunately, has not made the situation better. But us as parents and as the greatest advocates for our children, we have to make sure that on the other side of the pandemic, that we've come out better and that our kids actually get all the services that they deserve. It's a question of the budget. So also fight for a budget that is fair and that actually meets the needs of all of our students. And in fact, just earlier I was reading from Traeger, Councilman Traeger, that one of the problems that he has with the expansion of universal pre-K is precisely the same issue that we are having now. Kids with IEPs are not being included in that, and they are not, the services are not being provided, and the services are not being provided, and that even the teachers who deal and the people who are part of the support staff for kids with IEPs often enough get paid less, right? So as parents with kids with IEPs, we need you out there on the front line fighting and making sure that they understand that you mean business when it comes to providing the services for your children. And I'm with you on that one because, call me, I'll fight with you.
I love that. And yes, that's hey, biggest thing I think we've heard from so many parents, and honestly teachers too. Speak up, tell us, tell the principal, just speak your issues, what needs to be changed, what can be better, what just any of those concerns, because that's just such great advice, especially during these remote times. If you're not going to speak it, we're not in person, we can't see what might need to be different. So great advice there, Tiffany. I hope that helped out a little bit, and thank you for your call. I did want to bring in Dr. Johnson too, when it comes to obviously Eagle Academy and its partners, when it comes to special curriculum, special programming, and special services like we were just talking about. What's kind of the future, at least in your eyes, for those specialized kinds of things?
So, good evening. Thank you for having me tonight, and thank you for the question.
Mm-hmm.
I think when we talk about kind of the special programs, Eagle Academies are public schools. So we are we're in the trenches with everyone else, and managing and figuring things out. And so the foundation provides a level of support, but we also work with other partner schools across the district. I think when we talk about special programs, I think if we keep children at the center, and we allow leaders the level of autonomy to think about both their setting and their context, then they will have a better way of understanding what is the most appropriate special program to bring in place. These conversations, of course, have to happen in collaboration with parents and with the community, but that's how you think about these targeted and tailored programs. But what we will need in this kind of post-COVID time is we'll really need programs that really kind of address academic acceleration and don't focus on remediation, but really kind of helping to push students forward instead of kind of holding them back and going over what's all the things that we think that they missed. We've got to find some time and attention for mental health support, movement, and wellness. We've got to include programs that really allow students to provide some level of interaction. And I think we really have to provide some intentional strategies for the transitions back into schools and school settings. I think Kevin or Dr. Gracie mentioned transitional grades, but this idea of thinking about transitional grades, freshmen this year have never set foot in their high schools. So they don't know the physical space of their high schools to even understand where the restrooms are, where's the principal's office. So there has to be intention and strategy around how we bring the school community together, how we think about supporting students as they kind of get reacclimated to kind of getting back into this new normal. And so I think when we think about special programs, I think about how schools are able to leverage their partnerships and leverage their community-based organizations and activate the parents to really help to push and advocate for the things that we need for young people. I think there's going to be a lot of space for that to happen.
Such great points. And on that transition, man, just want to take a moment and honor students, period, for what literally all ages. We cannot imagine what they are going through. It's very different from all of our school experiences growing up, that's for sure. So just shout out to every student out there who happens to be in the living room or kitchen watching or wherever you're at. But shout out to you because this has been a time and it's not over yet. And obviously we're talking here about trying to look forward to even more of the future. I do want to continue talking about mental health because everyone obviously keeps bringing it up in their own way. Let's get back to Kevin because between the federal stimulus package that was passed and what the mayor has promised, which is that mental health resources and programming will be in schools for everyone, he says, come September, how important is it going to be for students after, obviously at that point it's going to be more than a year and a half into the pandemic and mostly remote learning? And are there more ways, what should this funding specifically go to if the mayor is promising these resources in schools come fall?
Yeah, I mean, I think that's really critical. And I think, Dr. Johnson, what you just said, hits the nail on the head in terms of what schools need to be doing, not as a special program, but really as just what schools are there to do. I mean, schools are there for the whole child. John mentioned that within, the mission of Catholic schools, but schools have to be there for the whole child. And I see schools as these hubs of the community, which are really places of healing. They're healing centers. They're that all the time, and they're going to be need to be that more than ever. And I think that we can look at the understanding of how we support social skill development and emotional well-being as on par, equal to, along with the intellectual development of the child. I think those things are not special programs or unique, going to be, they may be uniquely placed right now, but I think all the educators would say and agree with me that these are things that are always needed to be in place because our children are always developing socially and always need to grow emotionally. And so I think when we start to implement and look at every school, and again, I'll come back to what I said before, policies are made centrally, but they're going to be delivered locally. So what that program is going to look like in any one individual school that welcomes children back and supports their integration is going to be a little bit different. It may involve social workers or creative arts therapists or different types of sort of professionals, or it may involve just, bringing in community leaders, having parents present more at the beginning of the school year, finding ways to integrate the community supports that are there. One of the really exciting things I think happening in the city is the community school strategy that's in play in a lot of different schools. And I think that stimulus money could go to expand those efforts because those efforts recognize how parent engagement, community involvement, and mental health services are integral parts to bringing a whole child through the education process and not just focusing on their intellectual capacity.
So true. And Kevin, I had to write down what you said. You said schools are healing centers and they're going to have to be more than ever at this time. I just thought that was so powerful. And just like you said, John, really looking holistically at students. And that's exactly what a lot of teachers have told me just over this past year, really shifting that perspective of them as humans, not just as students in a chair and at a desk. So much more to talk about. Obviously, we could be here for hours, but we're only here till 8 o'clock tonight. So keep the comments and keep the questions coming here to News 12. I want to check back in quickly on the poll that we posted on our Twitter page here. What do you think the next school year should look like in New York? Well, in person still in the lead, but those votes are trickling in even throughout this show and as it goes on and on. So again, we are here with you until 8 o'clock and we're going to be right back here on The Next Normal. Welcome back to The Next Normal here on News 12. So much amazing conversations about the future of our education system and schools post-pandemic. Reminder that big square QR code that you see on your screen is going to bring you to all of the pandemic and coronavirus coverage that we've been covering here at News 12. So definitely at any point, just hold your camera up to that and it'll bring you right to our website in terms of all that coverage to keep you updated on that. But right now, let's get back to Amanda Bossard, who is checking in and getting to all of the social media chatter about schools and the future. Amanda?
Yeah, Jess, as you can see, a lot of comments coming in, and keep them coming because I'm monitoring social media, Facebook, Twitter, to get your questions to our panel, and I want to get right to them right now. So our first one here comes from Chris. He actually tags the New York City Health Commissioner in his tweet here. He asks, what's the delay in issuing guidance on New York State winter sports for CHSAA athletes? That's the Catholic League. So I want to get to John and ask if you could catch us up to speed on what you know about the future of sports for your high school athletes.
Well, the primary focus that we're looking at is making certain that we follow all the state and local guidelines regarding sports, and particularly with the high schools. Obviously, we're looking at whether or not those schools have the capacity, the health protocols in place, making certain that they have the appropriate liaison partnerships with local and state agencies to make certain that we communicate well to both those agencies as well as through the Archdiocese of New York. We're really looking at it from the perspective of we've done it so well up until now. We've been open from the very beginning. The Archdiocese has taken very seriously the effects of the pandemic, but also the safety protocols that we put into place. And it was through this very unique way of working judiciously, but also very intently in terms of considering the ramifications of acting too quickly. We found the Goldilocks zone, essentially, in making certain that we can open up any of our activities, any of our schools in a safe way. So we'll be monitoring it as events proceed in state and local government, but we want to make certain that our perspective is the perspective of safety first.
Great. Thank you so much, John, for chiming in and catching us up to speed. You touched on safety there, which is obviously such a big component on when we talk about schools and the future of education as well. A lot of people online talking about those new CDC guidelines about having students spaced 3 feet apart instead of the standard 6. And this Twitter user actually asks, how do small classrooms that are already not built for large classroom sizes accommodate this? And I want to get Dr. Gracie's take on how we get more students back into the classroom, especially with this new guideline, but still maintain that safety that's been so key in reopening our schools.
Sure, thanks. And that's a great question. And I think one that's on everybody's mind. And a lot of it is just doing a really good job of what you've probably all already heard of and what's been implemented. The wiping of surfaces, the washing hands, the social distancing, to the degree possible. But I think 2 of the most important ones, number 1 is if you're sick at all, stay home. So don't risk exposing others in your school. COVID is not always a severe illness. So even if you have sniffles, a mild cough, you shouldn't go home. You shouldn't go to school until you're sure that it's not COVID and you're not infecting other people. So that one's really important. And another is the masks. The single most important thing that you can do in a shared physical space with somebody else is wear that mask and wear it well. Has to be over the nose, has to be creased and really against your skin. If you have your nose out of it, it's not doing its job. If it has big gaps at the side, it's not doing its job. And if you are really vigilant about wearing a high quality mask around other people, it really goes an incredibly long way to protecting you from the shared droplets that's really the major transmission of COVID-19.
That mask has been so key throughout all of this and something that has played such a big role in getting our students obviously back into the classrooms. I want to turn over to this next comment coming in from Marty. This is in response to this new opt-in period that's been at the source of a lot of the discussion online. He writes, it's literally 2.5 months left in the school year. Why open schools now when Easter break is right around the corner? I think also kind of chiming off a little bit about high schools reopening at the start of this week. Angela, you talked a little bit earlier about how consistency has been so key for you and your family. Why is that the case, and why has that been such a point that you guys focus in on when having these discussions about remote versus blended?
I find that consistency is very important because it's directly related to their social and emotional wellness. And so they need to know that they're safe. They need to know that things are going to be the same today and tomorrow and the next day. They need to have some kind of schedule. It's like, remember when, you had your child, first had a baby and you got them on schedule. It just makes all the difference in the world. Kids crave that. They crave schedule. And right now, everything has been upended with COVID. And so having that consistency just changes the game. It makes them feel like everything is okay and it's going to be okay. And so that's why for me, it's been very much a big priority watching the mental health of my daughter and making sure that she is well with everything that is happening. And I should just also mention, one of the things that parents have to consider is when you change from, being at home 100% remote, and then you switch to being all the way in person, you have to consider also that the teachers that are assigned to you may change as well. So think about that. So the fact that you had certain teachers for certain subjects, those teachers may be 100% remote.
Yeah.
And so you may have your child assigned a whole new set of teachers. And what is that going to be like?
Yeah.
Especially add on to it, if they were coming into a new school as it was, never got to see what that new school was. And then now they went through this whole change and now they're going to go through this other change when you have them go back in. These are just considerations that parents have to take and keep in mind.
So true. Thank you, Angela, for that perspective. And thank you all for joining this conversation. We're going to be right back here on The Next Normal. Such an amazing conversation and discussion town hall event here on News 12. I just wanted to thank our panelists as well and give you a moment just for your final words of the night, starting with Dr. Gracie.
Sure. Definitely vaccines, masks, but number one on my list really is mental health. Check in with your kids, ask them if they're okay, have those tough conversations, and they'll open up. That's my number one.
Kevin.
Yeah, right on, Dr. Gracie. I think communicate with your children, communicate with your school, make your school a partner in this decision with you, take into all consideration all of the factors, and you'll make the best decision for you and your family. But really keeping that child also as a center piece of the conversation, knowing what's best for them, and letting that be part of your guide.
John.
Absolutely, I agree with everyone. Compassion, consistency, and communication. That's key to what everyone needs to do to make sure that our children are taken care of and that we take care of ourselves. That's our mission as human beings. We're so proud that we've done that from the start.
Love that. Farah?
Yes, so I would add to that. Yes, I agree with everything everyone has said. But parents, really keep yourself informed and decide whether or not this option to opt in is really the best for you from the 8 weeks to go. And I would say to the DOE, please be careful when you're talking about centered healing schools to make that a reality and not just buzzwords, big buzzwords. Because
all right, Dr. Johnson, I want to have Dr. Johnson have time.
Sorry, I just was going to say for families and students to maximize the summer, to build experiences, get out, move, do some artistic projects, engage the city, and read.
Beautiful. Angela, thank you so much. I'm sorry, that's all the time we have, but thank you everyone for joining in on this conversation here on News 12.